Hi, my name's Katie. I'm going to be your nurse today for your 1:30 appointment. Give me just 1 sec. I'm going to make sure I have everything I need. So I've got my pen light and my stethoscope and my gloves. Everything looks good. Before we start, do you use any assistive devices? Today we'll be using glasses, hearing aid. No. Okay. And can you tell me your name? Curran. And do you know where you are?
401 Brighton Ave.
And do you know what day it is?
Saturday.
Awesome. Okay, so patient is alert and oriented ×3. Level of consciousness is good, and memory is intact. Speech is articulated, and patient is alert and oriented. Throughout the assessment, I'm going to be assessing you at multiple different things, but if you have any pain at all ever, you just let me know. And are you comfortable now? Any questions?
I'm comfortable.
Okay. So I'm going to start with your skin, actually. And it looks like your skin is pink and pigment is evenly distributed throughout your body. Your hand is nice and warm and dry. No excess edema or inflammation. Checking for skin turgor. There's no tenting present and a brisk recoil, so that's great. Your nails are smooth and non-tender. Cap refill is less than 3 seconds, so your circulation is good as well. Moving into neuro, I'm going to give you 3 words to remember, okay? Blue, monkey, and 22. Can you say those back to me?
Blue, monkey, 22.
Okay, and I'm going to ask you those later on in the assessment, so if you can just try to remember those, that would be great. And go ahead and, can you actually smile for me? And frown? And puff out your cheeks? And go ahead and raise your eyebrows? Awesome. So your motor cranial nerves are intact, which is great. And then I'm going to have you shut your eyes, and I'm going to touch a couple different points on your body, and I just want you to tell me where I'm touching. Okay?
Right shin. Left thigh. Left foot. Right shoulder. Left shoulder. Forehead.
Awesome. So patient has good sensation in lower extremities, upper extremities, and in your head as well. So I'm going to have you stand up for me, if you don't mind. I'm going to have you just take a couple steps as I assess your gait. Okay, and you can come back to me. Perfect. Okay, so gait is normal. There's no limps or swaying present. And I'm going to check your balance. So if you can just stand on one foot for me. Awesome. And then the other foot. So balance is intact. And I'm going to have you shut your eyes and just stand there for a second with your eyes shut. Okay. You can go ahead and open them. And there's no swaying, so you have passed the Romberg test as well. Okay. So I will have you sit back down. We're going to move to your eyes. So your sclerae are white, no exudate present, no redness or inflammation. Your iris and pupils are round. Your cornea is transparent. And I'm just going to check your conjunctiva. And they're nice and healthy and pink with no exudate. Your eyebrows and eyelashes are evenly distributed and equal on both sides. And your eyes are oval on your face in proportion as well. So I'm going to check your vision as well. So we're going to do the 6 cardinal fields of gaze test. So I want you to just follow this pen with your eyes, okay? Good job. So your eyes move smoothly and symmetrically, which is great. And I'm going to do your peripheral vision test now too. So I'm going to put my fingers behind your head, and I just want you to let me know when you see them, okay? Mm-hmm. Okay. So peripheral vision is intact. Now I'm going to check a few more things on your eyes. So I'm going to move this pen light toward your nose, and I want you to just follow it with your eyes. Okay. And one more test. I'm going to shine the light in your eye. Okay, and on the other side. Okay. So, patient passed PERLA. Pupils are equal, round, and reactive to light and accommodating. Eyes are also consensual bilaterally. And patient has passed the peripheral vision and 6 cardinal fields of gaze as well. So that's great. Moving on to your ears, I'm just going to have a quick look. Your ears are fully formed and symmetrical on your head, adequate size for your body, and there's no drainage or any lesions or masses that I can see. Any pain with palpation? Okay. And then I'm going to whisper 2 words, one in each ear, and I want you to just say it back to me, okay? Bed? Gorilla? Okay, perfect. So patient also was able to repeat the words for the hearing test, no issues with hearing at all. Okay, so moving on to your nose. Your nose is symmetrical to your face. I'll have you press one nostril closed with your finger, and go ahead and take a breath in, and then go ahead and do it on the other side. Okay, so nares are patent bilaterally. Any issues with smelling that you've been having? Any excess drainage? No. Okay. And I'm just going to shine this light up there and look at your septum. Okay, which is right midline, which is perfect. So I'm going to move on and check out your head. So we just wear our gloves for infection control. Okay, so I'm going to palpate your head, just checking for any masses or lesions, any skull deformities, which none are present. Your hair is evenly distributed, and texture and color are adequate for body. I did your nose, so going to the mouth, I'll have you open your mouth and say, ah. Awesome. Okay, so there's no skin breakdown, no lesions on the lips. Inside the mouth, the tongue was symmetrical, teeth had good dentition, your tonsils were not inflamed, they were symmetrical, and your uvula was midline. There was no halitosis on the breath either. Okay. And then I'm going to palpate your sinuses. Just let me know if there's any pain or tenderness.
No.
No? Okay. So frontal and maxillary sinuses are not inflamed, and there is no pain on palpation, which is great. Moving down, I'm going to have you actually open your jaw and go ahead and shut it. Okay, so TMJ, no crepitus in the jaw. And then moving down, I'm going to palpate your neck, checking the lymph nodes, any inflammation or hardness, which no nodules were felt, no inflammation. There was no pain on that palpation, no swollen lymph nodes. So I'm going to check your swallowing. You can just swallow for me. Okay, good job. So swallowing is not an issue. The thyroid was not palpable. So no signs of goiter. Trachea is midline. And I'm just going to listen or feel for your carotid pulses. Carotid pulses are strong and even bilaterally at a 2+. I'm just going to have a quick listen. Awesome. So no whooshing or bruits was heard. Strength was equal and strong bilaterally. So then I'm going to test your range of motion in your neck. So I'm just going to have you put your ear down to your shoulder, to the left, yep, and on the other side. And then can you turn your head to the right and then to the left? And go ahead and look up for me. Yep, and look back or down. Awesome. Okay, no pain with that either. Okay. So now I'm going to inspect your pericardium, and just on inspection, I don't see any rashes or redness, no masses or lesions or any inflammation. And I'm going to have a quick listen to your heart. So listening to the aorta, the pulmatic. Do you mind just unzipping that a little bit? Thank you. Herb's point, the transcuspid, and the mitral. Flip my bell over. Okay, so S1 and S2 were heard, so no issues with the tricuspid or the mitral valve. No signs of bruits or any whooshing. All pulses sounded strong. So I'm going to actually check your radial pulse, which are equal and strong bilaterally, and then your posterior tibialis, and then your dorsalis pediis. Awesome, which are all strong. Let's see, can't really see cap refill because of your toenails, but no tenting present on the feet either, so patient is well hydrated. Okay, moving in to your breath sounds. So patient is breathing with ease and comfort. Chest rise and fall is equal bilaterally. Patient's not using any accessory muscles in order to breathe. So I'm going to listen to your breath sounds. You can just take a deep breath for me. Okay. Go ahead and, yeah. One deep breath. One more. And then I'm going to just check your chest expansion. So on lung sounds, there was no signs of bronchi or wheezing. And breath sounds were strong and clear bilaterally. So I'm going to have you take one deep breath for me. Okay, so chest expansion is normal for patient and equal bilaterally. Chest is cone-shaped. There are no signs of patient's body or posture is erect and head is positioned midline to the body. Just going to take a second. Okay. I'm going to actually have you lay down and I'm going to assess your abdomen. Oh, I was thinking your skin color looks great. There's no signs of pallor or cyanosis or jaundice present, so your pigment is still good throughout. Do you mind if I lift your shirt?
Nope.
Okay. So abdomen, there's no masses or lesions. And pigment, again, is normal. So I'm going to go ahead and listen to your bowel sounds. Listening for 1 minute in each of the 4 quadrants. and ball sounds are present. They're not hyperactive, hypoactive, which is great. And then I'm just going to listen to your vascular as well. So listen to the aorta, the renal artery, and the iliac. And those are bilaterally equal as well. No signs of bruits. The abdomen has the usual contour and waves. Again, no lesions, masses, inflammation, edema, anywhere present on the skin so far. Okay, you can sit back up for me. And I'm going to have you stand up, actually, and we're going to check your musculoskeletal. So I'll check your spine if you just want to bend over. Perfect. Yep, touching your knees. And I'm just going to walk my fingers along here on your spine. Checking for curvature, which is not present. Spine is nice and in line. And again, patient's posture is good and erect. So actually I'm going to grab just check your hips. Okay, and bend over one more time. Okay, perfect. And your shoulders, looking at your shoulders and your hips are even bilaterally, which is great. I'm going to have you maybe stand right here. Okay. And I'm just going to put my hands on your joints, and I want you to make big circles with your arms. Okay. Perfect. So no crepitus or swelling or pain in your joints. Go ahead and do it one more time with your elbows. Okay. And then with your wrist, make a circle with your wrist. And I'm just going to palpate down your fingers. Okay. And then on this side with the elbow. Okay. Make a circle. And I'm just going to palpate down. So your joints seem to have no pain. There's no crepitus heard. You have full range of motion in the upper extremities. I'm going to do the same thing with your hips. So go ahead and do one leg at a time and just, yep, perfect. And the other leg. Awesome. And no popping or clicking or anything or crepitus was felt. And I'll have you sit back down. And can you just move from your knees, put your legs up? Perfect. And then your ankles, make circles. Okay, good job. So full range of motion as well in the lower extremity. And now I'm going to test for strength. So I'll have you put your arms straight out. Okay, and push up against me. And push down. Okay. So strength is 5 out of 5 bilaterally in the upper extremities. And then I'm going to have you do the same thing. So can you kick your legs up? Okay, and resist against me. Okay. And then other way, pull up. Okay. And strength is bilateral, 4 out of 4 in the lower extremities. And then do you remember those 3 words I gave you earlier?
Blue 22 gorilla.
Blue monkey 22.
Blue monkey 22.
Okay, good job. That was pretty close. I think I'm done.